Good afternoon, everyone. Welcome again. Thank you for being here this afternoon for this webinar. We're very excited to be talking about some lessons learned from Project Protect's Preventative Healthcare Survey. So before we get started, for those of you who may not be familiar with us, we are the National Center for Farmworker Health. Our mission is to improve the health of farm worker families, and we do this in several ways. First, by providing capacity building, health promotion and education, farm worker outreach, and research and data collection. I'm excited to introduce you to our speakers today. Joining us from Project Protect in Colorado, we have Hunter Knapp, who is the Development Director of Project Protect Food Systems Workers. He joined Project Protect in 2021 after completing a postdoctoral fellowship with the University of Colorado Law School, where he authored articles about agricultural workers' rights and political representation of immigrants. Hunter leads fundraising and report writing for Project Protect while also tackling any emerging issues that affect the organization. His work focuses on elevating the voices of marginalized community members and addressing health disparities affecting rural Colorado. We also have today Kasey Neiss, the data and evaluation analyst. In her evaluation research work, Kasey brings expertise in community-based evaluation and passion for equitable food systems, agriculture, and data governance. She holds an MA in cultural anthropology from the University of Denver and a BA from Hampshire College in U.S. ethnic studies and oral history. She currently works with Colorado Blueprint to End Hunger as the data and evaluation analyst and as a freelance research consultant with many food sovereignty nonprofits in Colorado. Kasey lectures on data visualization, research methods, and anthropology at various universities and colleges in Colorado. Previously, she served as Frontline Farming's and Project Protect Food System Workers Director of Data Activism, where she led data storytelling projects that centered farm workers, women, and people of color in Colorado's food system. And then we also have Zoila Gomez, who is a regional director at Project Protect. Zoila is a community leader. She was raised and born in Mexico and moved from Mexico when she was 15. After discovering athletics in high school, she earned an athletics scholarship to Adams State University. In 2004, she was named the best female athlete for all sports. And upon graduation in 2004, she chased her Olympic dream for 12 years as a marathoner, made 3 world championship teams, and became an Olympic alternate for Team USA in 2008. In 2016, she applied for her first ever job outside running with Cooking Matters. Nutrition was a big part of her life as an athlete and loves teaching nutrition education, both in her native language, Spanish, and also in English all around San Luis Valley. In 2020, she was invited to join Project Protect's Promotora Network. And in 2021, she took the position as a regional director. She leads a group of 5 promotoras in the San Luis Valley. Wonderful. We have 3 excellent speakers here today to share with us about their work. We have a few learning objectives for our time today. By the end of the session, you'll be able to describe key components of a community-driven approach to data collection in farm worker populations, including the role of promotoras, which Project Protect is very skilled at doing. You'll understand strategies to build organizational capacity for engaging communities in participatory data collection and assessment initiatives. And we'll discuss how community-validated data can be used to shape health equity interventions, inform policy, and enhance service delivery in rural and agricultural settings. So with that, I will pass it over to the Project Protect team to get us started.
Thank you so much, Katie, and thank you, Vanessa, and really to the whole NCFH team. It's our pleasure to share some of the great work of the Project Protect Promotora Network with you today. And to start off, who are we? So, Project Protect Food Systems Workers, or Project Protect, started in 2020, initially to respond to the COVID-19 pandemic by providing educational information in Spanish, resources like mobile tests, and eventually access to vaccines. At the same time, we started addressing other health disparities that have been affecting agricultural workers and their families for generations. In 2021, we were heavily involved in advancing a piece of state legislation to advance agricultural workers' rights related to minimum wage, overtime pay, heat stress, access to service providers, and several other rights that were all bundled into a suite of legislation. And then we were heavily involved in the rulemaking process and elevating the voices of workers to participate in that regulatory process. Of course, I want to thank the Colorado Department of Public Health and Environment for funding much of the work of Project Protect over the past 4 years, including the Preventative Healthcare Survey itself, which was funded by the Senate Bill 181 program of the Health Disparities and Community Grant Program. Next slide. These are just some pictures of our team that I wanted to show off. You can see Kasey there in the top right at our annual Festival de Maíz, where we come together and get to celebrate with some cooking and generally getting together with our statewide network. In the bottom left, you can see Zoila with some of her team and volunteers at the community pantry in Alamosa. And then the literal only picture of me doing Project Protect stuff is in the bottom right. And of course, I'm staring at my laptop because that's typically how I spend my days. Next slide, please. And Zoila, can you talk a little bit about the Project Protect Promotora Network?
Absolutely. Thank you for having us. So Project Protect Promotora Network, we are a group that is culturally and linguistically set to do outreach and do our resource distribution. So being bilingual has played a big role in what we do. We also have in our community, we have one promotora who is trilingual. We have a community that it's a big community of workers that are from Guatemala, and they speak Cangobal and certain dialects in Mayan. So having that being able to speak three languages and being able to communicate one-on-one with our during our outreach is huge. As Hunter just mentioned, we're community-driven data. Because we know that this actually helps in the long run when we are advocating for our outworkers. Next. So we are in the network, we are a group of 25 to 30 community leaders. We are only known as promotoras. We're in 6 regions. Each region has a regional director. So I'm the regional director for the San Luis Valley. And under us, all of our regional directors have promotoras under their wings. So all of us work together. We do food distributions all over the state. Just by data, we distribute about more than 10,000 food boxes a year. And I would say even more than that. We have done educational campaigns related to vaccines, back then COVID, H5N1, environmental justice, and recently we've been really at it with workers' rights. Can we move to the next one? So as you can see, the entire network, we on the bottom picture, all of us got together to do a clinic up in the Greeley area. So you see regional directors and promotoras, whoever was available that weekend to do, I believe we were doing the Farmers Fund then, and we heard of this greenhouses that really were not touched, or they had not access to the fund. And all of us came together as a network and met really and did this this outreach. Actually, it was not in Greeley, it was in Brighton, the Brighton area. Sorry about that. In the bottom, you have Dolores. Dolores, it's our regional director and promotora from Greeley, who, she puts on these beautiful displays during Dia de los Muertos. Every festivity that you can think of, she thinks outside the box and goes the extra mile to really involve the community and make people have these spaces so people feel comfortable and celebrating these festivities. And of course, we have youth volunteers. Either they can be our family members or people in the community, that just kids that come and help us out. In the San Luis Valley, personally, like I do get involved, my nieces and nephews, neighbors, or people that I met in the past. And again, this is just a sign of how involved all of us are in our communities. Can we move to the next one? So some of our promotoras either work in the past and as ad workers, so they know exactly what our ad worker community goes through, or either have a deep connection within the community. Again, these are relationships that are built over the years, so it's not like just going into a community and you try to navigate. Like, these are community leaders that have been in the community for a long time and have gained trust. Like we mentioned, all of us are fluent in Spanish or any other language. And this really has helped us to connect with people and really get to that her voices have never been heard, or that have never been reached out for feedback or any of the topics that we're trying to address. So with that being said, we have become the face for our workers to come, and they really look at us as advocates, someone that they can trust, and they can come and address any issues or ask any questions that they may have that may require any sort of service outside their jobs. We can go to the next one.
Thank you, Zoila. I'm going to talk a little bit about a community needs assessment that we completed in 2023, again, with funding from our state public health department. And this collated and brought together a lot of the data that we had been collecting over the course of the second half of 2022 and the first half of 2023, and tens of thousands of conversations with agricultural workers, and then the weekly regional director reports that identified those needs in the community. And so, perhaps unsurprising to a lot of the folks here, food security, healthcare access, and language barriers were the three biggest concerns affecting agricultural workers and contributing to these long-term health disparities. And like I said, it wasn't a surprise to really identify these issues, but it did inform some of our future program design. It helps with fundraising to have a sort of formal statement of the needs in the community. And then it eventually led to the preventative healthcare survey that we're about to talk about. Next slide, please. And now I'm going to pass it to Kasey to talk about the preventative healthcare survey.
Hunter. After we identified those top three areas, we launched this preventative healthcare survey. And our goal was just kind of to set out a landscape of what does preventative healthcare look like within agricultural worker communities. So the survey questions were co-created with both myself and Hunter, as well as Zoila and the other regional directors, as well as some input from the promotoras. And so this was a really ground up survey design. The forms were done in both Spanish and English with some open-ended write-in responses so we could get the flexibility. Since we didn't know exactly what we were going to find, we had like a concept of what we wanted to look at, but we wanted to give the ability to elaborate where needed if our survey did have some blind spots. So there were some write-in sections to capture those realities. And we didn't capture any personal identifying information. So things like name or where you worked or the name of the employer or the zip code. Those are things that we did not, we specifically omitted from the survey and did not ask about. Next slide. So the survey was designed to fill gaps left by a national data set. The National Agricultural Workers Survey, or NAWS, does survey Colorado, but it's about 80 to 100 workers every time they do the survey. So it leaves a lot of workers who haven't responded to it. Furthermore, that the public data set is aggregated by the mountain region. And so it includes, Montana and Wyoming, as well as Colorado and the other states in that region of the USDA. So we didn't have a really good sample or understanding statistically of what agricultural workers in Colorado were facing for preventative health care. So the regional directors and promotoras did complete all of these surveys on paper during in-person outreach, as Zoila so cleverly laid out the work that we do. A lot of this outreach happened in tandem with education or delivering food boxes. And so we were able to pile on, so to speak, this data collection with the actual benefit set Project Protect is providing. We didn't set out with any sampling guidelines. In other surveys we've done, we've set out like, get this many workers from dairies and this many workers from vegetables. And we didn't do that in this one. Moreover, we actually allowed ex-workers, people who have left the industry, to answer it as well, because since it was a 2004 survey, we were just trying to understand the scope of what was happening in communities and understood that there's fluidity there. Okay, next slide. So our survey contained 3 demographic questions. That was gender, language, and age. We also did ask about sub-industry and whether or not folks were on here on a visa. We did not ask anything about citizenship status or any of that private data. It was really just language that we used. So language, age, gender, and then the industry in which you work in agriculture. So dairy, orchards, the field crops, etc. We also had 15 questions assessing the prevailing healthcare practices that folks are accessing while they're in agricultural communities. We did, and I said no citizenship information. And then this data comes from September to December at the end of last year. So it was a very specific time frame that we sampled in which also meant that we were capturing the end of the season. However, some workers in Colorado do leave a little bit earlier. And so since some of these surveys were done in the winter months, I want to acknowledge that there were some gaps that some folks that we might not have surveyed the complete agricultural community for workers who move with crops or might leave in August or September. Next slide.
I want to add one more thing, Kasey, and I apologize. I left a bullet point out of this slide. Although we didn't ask about citizenship status or national origin, we did ask about H-2A status, and these workers are also not included in the National Agricultural Workers Survey. And so we think that it is some unique insight included in our survey. So sorry about that, Kasey. Next slide, and then Zoila is going to talk a little bit about the demographics of the survey respondents.
Yes, so we went ahead and collected 595 responses from agricultural workers and families. As you can see, a lot of the median age was 38. The average age was 40, and then 65% of the respondents were males. And one of the things that really reassure us about the work we're doing by being bilingual is that more than 90% of the respondents spoke Spanish. And again, with those in there, remember our Cangobal and Mayan community. Next. So like Kasey was saying, we did these surveys not just to, really did this keeping things in mind, being mindful about getting everybody involved in the survey. So when we did survey people that work in the vegetables, or like in my area, we have a lot of people that work in the lettuce, potatoes, in the carrots. We have people, livestock. We do have chickens, like in my area, but interestingly enough, most of this industry with chickens is run by the Amish community, and they are not interested in getting involved in this survey. So other areas in the state were not Amish. The Amish community is able to survey them. And in other areas, like up in the Western Slope orchards, were surveyed there because we don't have them in the Standing Valley. So every region is pretty unique, and that's how we were able to gather all this info statewide. And like Kasey said, I just want to add, we did include people that is not longer, that left the industry and is not longer employed, but their feedback is pretty valuable because they left, but they know a lot about what's behind the scenes. Next. So here you see a graphic of, just to give you an idea of a breakthrough, the pie on how this is distributed. So as you can see, in the state of Colorado, we grow a lot of veggies. So farmers markets are coming along. Make sure you support them. Now I'm speaking local here, so just keep that in mind. I think that's something that you can take away from this, where you can go and support our farm workers, our farm working community. Next. So we did samples in, like we showed before, in different industries. Hunter was talking about our H2A workers. In San Luis Valley, we have a big group of H2A workers that come. We have a farm that employs close to 230 H2A workers. For those that don't know what H2A workers are, these are workers that are contracted, that come to the country with a visa, and their visa is called H2A, and they come and work temporarily. Like normally they're here for 6 months. Some of them arrived, like here in the San Luis Valley, they arrive in March and they go all the way to October. And right now they're in peak season. So as we speaking, they're out in the field speaking out our lettuce that is distributed nationwide, and they're part of Axocio. So they were included. And then as it was mentioned, they are not included in the National Agricultural Workers Surveys, known as NAS, but they were included in our survey. We move to the next one.
Thank you, Zoila. And now we are going to get into the survey results. And Kasey, I'll let you take it away.
Yeah. So we've mentioned NAS and AWS a couple times now, and these first three questions actually were originally kind of pulled from the NAS survey itself. So that survey does ask about, do you have health insurance? Does your employer provide health insurance? Does your employer provide sick days? Does your employer provide workers' compensation? So there are some specific questions that we originally pulled from the NAS. And I think A couple of these questions we adjusted slightly to ensure clarity when we were doing the survey. For example, instead of asking, does your employer provide workers' compensation? We asked, does your employer continue paying you while you're recuperating? So we define what that was in the question itself. And all of these questions were yes, no questions. Yeah, and so I think that there was still, what we did find was there is still some confusion about workers' compensation versus sick days and all of that stuff. There is some just kind of misinformation that remains out there because there is some kind of like conflicting yes, no within our data. But generally, we were able to find a lot out. Next slide. So this, I dig in specifically to this employer provided health insurance, worker compensation, and paid sick days. What we have here are two tables. The first one presents the overall percentage from our almost 600 survey responses. And so this is the numbers spread across every single respondent. The bottom table breaks it down by H2A and non-H2A so that we can see that there are some spots where we're seeing a big difference between the different access points within preventative healthcare. These two tables do reflect the NAWS, and I apologize, I can't remember what table in that survey data it is there, but it does reflect that same kind of setup where it's a yes, no, or I don't know for these questions. I want to bring our attention to in the bottom table for employer provided health insurance. 41% of H2A workers said that their employer did provide health insurance, as opposed to 16% of the folks not employed in H2A. And so that's going to be actually the majority of our data set is non-visaed workers who are not accessing health insurance through their employer. Another large difference that we saw was the paid sick days, where about 50% of non-visaed workers, resident or migrant local workers, 49% said that they were not getting paid sick days, which is, again, revealing some gaps in access to legal rights under our worker rights laws. I want to pause here and see if there's other spots I wanted to call out. I think what we saw the most was the employer provided health insurance was the hugest gap between H2A and non-H2A. But overall, we only had about 20% of our whole survey population who were getting employer provided health insurance. So we're seeing that for the most part, it's just not, that's not how people are accessing healthcare. Great. Next slide. Okay, so another question, do you currently have health insurance? This was separate. It wasn't divided by what type of health insurance you get, so we'll get to that in a minute, but we had a vast majority said that they did not currently have health insurance. And so we're seeing a very small population who are covered and insured workers. And we do know that this is a very dangerous industry, not only from injury, but also just kind of continuing to work through sickness and illness, being in contact with cattle for the H5N1. We're going to see folks getting sick as well as injured. And so to see this number again gives us leverage in advocacy work. Next slide. Um, so this breaks down the type of insurance workers are getting for the ones who are getting work coverage. So that little the red wedge that we saw on the last screen, this kind of breaks down who is providing insurance within that red wedge. So government insurance, employer provided insurance actually was the number one for folks who were getting insurance. It was common. Part of that is because we had some H2As and that is required. But we do have within Colorado, a lot of folks are eligible for Medicaid. And so we saw a number of folks who were getting insurance through government insurance, through Colorado provided insurance. In Colorado, we have and Hunter, I'm going to lean on you to make sure I'm saying the laws right. But in Colorado, folks who are there are emergency Medicaid systems as well as like child health and coverage and I think those are the two main ones. Omni Salute would be the other one. Omni Salute is for folks who are undocumented. And through that, we're seeing a lot more folks getting access to insurance through being eligible under varying immigrant statuses.
The only thing I would add, Kasey, you nailed it. But this question I think is going to be particularly interesting when we administer the survey again this year and in 2026, as we're dealing with the looming cuts to programs like Medicaid. It'll be really interesting to see how these percentages shift over time. So, next slide.
Okay, so and stop me if I get to question 8 because I know I handed off there. But these two questions were questions that came out of conversations with Zoila and her colleagues of like, what else should we be asking about on this survey about how people are asking or are gaining preventive healthcare services. And so one thing that at least we have here in Colorado is that hospitals do have funds to provide financial assistance. So if you can't pay up front, like there are loans, there are financial assistance, there are repayment plans, there's income-driven payment plans as well. And we wanted to gather data on the knowledge around these programs. So one question we asked was, are you aware that you can ask for financial assistance in hospitals? Majority said no, which wasn't super surprising to us, but we actually have a large portion who know about it as well. And so that means that we can actually promote cross conversation within worker communities to help them educate each other about what the ways they are connecting services. As a follow-up to that question, we also asked among those who were aware of financial assistance, did you use that option? And so some people did say no, that they didn't use it because maybe they didn't need it, but also maybe they had embarrassment around asking for that assistance, or they didn't want to raise any eyebrows and didn't want to draw attention. However, what I'm really happy to see is that those folks who know about it, the majority of those folks are using that assistance as well. And the more positive experiences that those workers have, again, the more the good news spreads around community. I had this really good experience. Let me tell you how I paid for that. You can go to the hospital and it's going to be okay. All right, next slide. And this is my last one, right? Okay, so this question, in the US in the last 12 months, was there ever a time that you needed healthcare services but could not get them? This in our larger report, we have a number of barriers listed out that explains why people might or may not have gotten them. The point is that almost half of our respondents reported at least one barrier, whether that was distance or cost or not being able to take off a day of work. There were a number of barriers reported. Again, the primary barriers here was the availability of providers. So I know, Zoila, you could talk about this forever down in the San Luis Valley. There aren't that many doctors. You can't get an appointment. It's 6 months out. Like whether you're going to a dentist or a specialist or your primary doctor, there are so few practitioners that you can't actually get into the doctor's appointment. There's also high costs of healthcare as well as just like the lack of insurance in general and not knowing how to navigate that when you go to ask for support. I don't want to run out over time, so I'm going to pass it to Zoila.
Oh, actually, I'm jumping in here, but
Oh,
let's go
great.
to can you actually jump ahead 2 slides, Kadie? Gonna mess with the order a little bit. Perfect. So our next question was about, well, the question after that was about special medical conditions and needs that family members had. And this was a really fruitful question for informing some of our future work. It was an open response question, which allowed for a lot of flexibility. It also made coding the responses a time-consuming process. And so one of the things that we'll be able to do in future years is take the large groupings that we identified. There were basically 9 large groups of conditions that people selected, as well as some other long-term conditions. And we'll have those 9 as selectable options with an other box. And so just in terms of survey design, I did want to make that note. Diabetes was the #1 condition. Diabetes, heart disease. Again, it was a lot of things that weren't terribly surprising to a lot of us here who are interacting with agricultural worker communities on the regular basis. Okay, now can we go back 1 slide, Kadie? Excellent. So now I want to talk about a couple of questions that didn't work out exactly how we hoped. And I do want to shout out Kasey for her brilliant design on the survey. Some of the questions with the multiple graphs she was able to combine into one perfectly written question. And then a couple of the questions we tried to collect some numerical information about the household, and that became a real challenge in terms of recording the data consistently in a way that gave us viable data. And so this question, how many family members currently live with you in the US? Parentheses, write the number of people next to each age group. And we did do training with the directors and promotoras. But when you're out in the field filling out a 15-question survey, it's just sometimes you put a check mark instead of a number. Sometimes you just put a dash. Sometimes you don't answer the question at all. And so as I was analyzing this data, I sort of made the decision that rather than trying to piece together some incomplete picture of family size of agricultural workers in Colorado, we would wait until next year and potentially reformat the question rather than giving the impression that we knew something that we didn't know. Similarly, Kadie, can you jump ahead 2 slides and then we'll be back on track? So another one where we were asking for numerical data, and this was about medical insurance in the family. And so, again, a lot of agricultural workers, particularly H-2A workers, they might be living in the United States on a temporary basis, and they have a family back in Mexico or Guatemala or their home country. And so this question resulted in some confusion based on conversations I've had with our directors. And again, it was just sort of a consistency of the numerical thing where we got a lot of people putting checkbox for government insurance for their kids. And although it was valuable to know this is a source of care, it didn't generate sort of numerical quantitative data that we were comfortable moving forward with. So next slide, please, and we'll get into the final components of the survey results. And back to you, Kasey.
Wonderful. Okay, so this this question we asked to please list the top health concerns for both you and your family. Again, this is another manually coded response, and shout out to Hunter for reading each of them and trying to make sense of how to group things together. Some people are going to talk about diabetes, some people are going to talk about blood sugar. Do we group those together? That's a question that we addressed in the analysis process. So we had 231 respondents who did do write-ins and expressed a total of 253 concerns, and health concerns were categorized into 12 groups and a group called other long-term conditions. If we go to the next slide, we can see the graph. Great. Oh, this is health concerns. So health concerns, there were a lot of folks who talked about money, and a concern around illness or death. But really what we saw, and this, I want to actually point out the diabetes and blood sugar one, because I think that this is something that comes up a lot within agricultural worker communities, not just in Colorado, but I've seen these numbers come up on a grander scale. And so these are the kinds of things that we want to make sure we're capturing so that as we get more folks access, we know what kind of specialists and doctors are going to get more of those requests and services. And then the other one I want to point out is dental health is something that has been brought up a couple times in our communities, and we have done a survey on that as well. And Zoila's team was the one who led it. But talking about access to dental health and what was needed within those communities. And we actually saw that a lot of those workers were getting support on dental health. However, it is a common concern when people are in pain to the point where they can't work. Like, dentistry is important. But in general, the common concerns around healthcare and healthcare concerns was just not having money and just worried about illness, worried about what do? I don't have money, and what if I'm sick? What if I'm like terminal? Interestingly, mental health came up a couple of times. This is because I think a number of reasons. We do see some domestic violence within our communities. We see drug abuse within our communities. This is not unique to ag workers at all. This is a concern across all of the continent and the world. So I think knowing that it's there, knowing that people feel comfortable enough to talk about it and tell our promotoras to write it in, to write it down, is a testament to the trust that we've built. Yeah, that's all I'm gonna say on this graph. Next one. Okay. So this question we asked, in the US in the last 12 months, have you used any type of healthcare services from doctors, nurses, dentists, clinics, or hospitals for any of the following conditions? And we listed a number of conditions. This was a closed-ended question where we provided the list for them. 64% of respondents had used healthcare services in the US. And interestingly, vaccines was the most common healthcare service utilized. And part of that is just owed to the promotoras doing really beautiful work on getting these access to the workers, bringing mobile clinics out and organizing those events where when we have a Dia de los Muertos, we have a vaccine clinic there as well. And so that was a really beautiful thing, I think, that demonstrates the impact of this network, as well as the importance of making sure preventative healthcare, vaccines are very much preventative, are provided to these workers, whether or not they're here temporarily or permanently. Next slide. Oh, Hunter, please.
No, now we have Zoila for the final two questions, 15 and 16. So this is that graph of the last slide, but can you go to the next slide, please, Kadie? Take it away, Zoila.
Thank you. So question 15, we asked, in the last 12 months, how have you paid for your health services for you and your family? This one was very interesting because we did learn about the different programs that different areas were providing, and all of us came. It was pretty interesting to see the sliding fee discount, income-based payments, payment plans were very common, or most common ways for people that were uninsured, and then insured people were only 38%, with those responses being like that, yes, they were insured. Next one. So as you can see, the pie again, you see the sliding fee discount or income-based payments. That's the green one. That's next to the government insurance, insured. But then you have other types of one that I found interesting is the out-of-pocket paid in full. Still 4.7% that are paying in full. Even though the number looks pretty low, when you have a family that is struggling to pay the bills, it's really heartbreaking. So you don't want any of those in your community, or you don't really want anyone to be going through that. So we go to the next one. Number 16, where have you or your family gone to get health care? So more than 60% responded that they went to a community health clinic or free clinics. Also urgent care and emergency rooms, both were significant sources where healthcare services were provided to our agricultural communities. Yeah, I would also learn a few things about that it's not showing here, but like we learned like statewide, that some would just even call doctors. Maybe this was in a different survey, but they would call the doctors back home for checkups, just because they didn't have insurance or time. Like time is huge. Kasey talked about appointments being so long, but not only that, like our ag workers are tough. They'd rather be working. They tough it up. So it's pretty interesting. We go to the next one.
Thank you. And now I'm going to close it out by talking a little bit about how we're going to use this data. Of course, I mentioned it's funded by our state public health department, and we're turning it in for the grant deliverables. At the same time, we're going to post it on our website, generate some blogs to do some search engine optimization and kind of build the credibility of Project Protect as a source on these sort of topics. Next slide, please. And the data itself, I think, provides really strong evidence for any efforts to expand access to healthcare. Unfortunately, I think right now we're going to be trying to defend the healthcare that we have. Kasey mentioned that Colorado has a lot of great programs designed to increase access to healthcare insurance and just healthcare services for immigrant communities. But the free clinics that were the most popular source of healthcare are certainly under threat right now. And so we are hoping that our partners can use this data in their funding requests and things like that to hopefully build the public health system up a little bit in Colorado. And lastly, I'm going to try to get it published in an academic journal. I'm just so proud of all of the great research that the Project Protect Promotora Network did. And I think it's so impressive, like the quantity of the data, the quality of the data. And so I want to get it out there in the academic discourse as well. Next slide, please. So lastly, during this time when trust in the government is at an all-time low, I think it's even more important that we are documenting these sort of topics and issues affecting agricultural worker communities. We mentioned that we sort of blew the National Agricultural Worker Survey out of the water in terms of our sample size. And I think we can expect that the sample size for those national data collection will only decrease as funding gets restricted. Honestly, they might cancel the National Agricultural Worker Survey. That would not even surprise me at this point. So, this sort of state level data and community based data collection is going to be more important than ever. And I'm hoping that this will create an opportunity for us to fill the gap and start getting some more authentic community informed data in the hands of people who are making decisions. So thank you, everyone. I know we have a tiny bit of time for questions, but in particular, I want to thank Kasey and Zoila for presenting with me today. There's our email addresses in the chat, and I will pass it back to you, Kadie.
Thanks, everyone. And yes, if you want to stay connected with this team here, is their contact information on the screen. And we thank you so much for your time. This is where the recorded section of the webinar ends.